Hey everybody, it's David. I'm your host of Highway to Health Podcast, and I say it every time, but I really mean it. Thank you for being here. We have an incredible community, and we celebrate the people that are a part of this community that do everything that they can to improve the experience, the access, the outcomes for our patient community. Today, we're going to talk about this intersection between risk management, business insurance, and then health insurance, and how they all come together to improve those things that we're passionate about talking about. And I'm excited to welcome Madison Baker, VP of Risk Management at Marsh. We're going to hear a little bit about your story today, but first, thank you for being here. Welcome to Highway to Health.
Thank you. I'm so excited to be here.
I'm excited to have you, and it's going to be a fun conversation. I've gotten to know a little bit about you, just getting to know you over the last few months, and you've got an inspiring story. I appreciate you being willing to share it with a wider audience.
Of course, of course.
As you know, we start the podcast this way almost every time. Share with us a healthy habit that you've implemented in your life to help you perform at a really high level, both mentally and physically.
So I think I've shared this with you. I'm a little bit of a biohacker, so I've tried a lot of things. I've tried fasting, I've tried cold plunging, which is all the rage right now.
It is.
But a habit that I've implemented, or I guess something that I've eliminated, is alcohol.
Yeah.
So I'm on day 123 of not a sip of alcohol.
Congrats.
So not even a sip. My dad tried to bribe me at Christmas because he got a bottle from Italy. And he was like, you have to try this wine. It's incredible. I didn't even have a sip.
Wow.
So for me,
I would have folded.
Yeah, I think a lot of people would have.
A good wine is, yeah.
That's the one thing I miss. But I will say, I don't think there's anything that you can do more simple that has more of a monumental impact. So I say simple and not easy, because
Right.
Simple and easy are very different. Eliminating alcohol is not easy. But the physical benefits are undeniable. Energy, sleep, mental clarity, the list goes on and on. But for me, the biggest impact, I think, has been more of the mental side. So just confidence. I mean, there's nothing like being in a room full of people that are drinking and have kind of a false confidence from the
Right.
from the alcohol, when you are utilizing nothing to exude confidence. And I've learned over the course of this experience that I don't need alcohol to have conversations. I don't need alcohol to be confident, and it's been an enlightening experience for me.
Well, it's a growing number of people in my circle that are eliminating alcohol from the routine, and they all say the same thing. But one thing that you've said that I haven't heard is the confidence side.
Mm-hmm.
And obviously, mental acuity, clarity is a benefit a lot of people have mentioned. But the confidence side I find interesting.
Yep.
Because you're right. I find a little bit more liquid courage, right? That's why they call it that.
And it feels like, I compare it to being the person that gets up at 5 a.m. while everyone else is in bed and warm, and you go out for a run. It's this superpower that you have. Not drinking feels a lot like a superpower, and that you have kind of a leg up, because you're doing something that a lot of people, not that they can't do it, but they don't want to.
Do what others are not willing to do.
Exactly.
So that you can then do what others cannot do.
Exactly.
How long did it take you before you stopped missing it? You know, you probably craved it for a period of time. When was that date that you thought, I'm good?
90 days.
90?
So
3 months.
yeah. So there's science behind it too. So through my research, I learned, and through conversations with other people that live alcohol-free, 90 days is really that inflection point. And it's because alcohol lasts in your system for 90 days. So
I can't believe that.
A lot of people don't know that. I didn't know it. But it actually stays in your hair follicles for 90 days. So traces of alcohol are still there. It's still in your system.
What if you're losing your hair? Does that help?
Yeah, certainly, I'm sure. But yeah, after 90 days, I don't crave it anymore, which I never thought I would say. I loved red wine.
Yeah.
And who knows if I'll ever drink again. I think that's too big of a statement for me to make. But for right now, I know I'm not drinking today.
Man.
Yeah.
Well, congrats.
Thank you.
And like I said, more and more people that I'm close with have said that, and my wife and I have considered it. And you're right. It's not easy, but it's simple and save you a lot of money too along the way.
For sure.
Those bottles of wine can be expensive.
Yeah, the nice ones.
Bottles of whiskey too. All right. So let's shift to business a little bit. So I know your primary focus is business insurance risk management at Marsh, but there's a little bit of an overlap, and there's this intersection of health insurance, business insurance, and risk management. And you sit squarely in that intersection with your role. Tell us a little bit about that dynamic, not only at Marsh and in your role, but just holistically.
There's a common misconception that risk management is solely resided on the business insurance side. But employee benefits insurance in itself is also risk management. My counterparts on the employee benefits side are managing the risk of losing key talents, their employers, retaining employees through their benefits programs, the risk that lies within, certain industries having employees that are in environments that can lead to more sickness. So that's risk management in itself. And I think our approach to risk management at Marsh is unique in that we take a holistic approach. So in our industry, you'll typically find that brokerage firms are siloed. And I mean by that risk management and business insurance is on one side.
Right.
And then employee health and benefits is on one side, and they operate separately. And what we found is that we are able to deliver for clients in a much better fashion if we bring those two sides together. So the data, the claims data that we have, we intersect that data. The strategies and solutions that we're delivering on both sides, we strategize on those together. And what that gives us is the ability to take a holistic approach from the client level on seeing both sides and really deciding where we can make the most impact. And something that we built internally at Marsh that allows us to do that is called Workers Health 360. So in simple terms, what that does is it brings the medical claims data from a client and the workers' compensation claims data from a client, and using the information from both of those sides to find out where the trends are and find out where we can zero in, laser focus, whether that be a wellness program, say, it's a client that's in the warehousing space and their employees are lifting a lot of heavy stuff. And we find that there's all these strains and they're having to get chiropractic work done. We can zero in and create a wellness program that is centered around helping them build their core muscles. And so it mitigates losses on both sides for the client. And it's just a different approach to risk management as a whole and looking at it a little differently.
Yeah, I mean, you can't have a business without a place to do work, but you also can't have a business without the people to do the work.
Yep.
And so they work hand in hand in my limited exposure, limited knowledge. But that begs the question, why did you choose, the business insurance risk management side over health insurance, over here on the healthcare side with all the cool people? Why did you choose business insurance?
The simple answer is that I did not understand health insurance, so I didn't know how to choose my own plan when I was, a kid in college. And actually, I'm one of the weirdos that studied insurance in college. So I remember sitting down with my dad when I decided to go to the University of Georgia, and I knew I wanted to do business, but I didn't know exactly what I wanted to do. And my dad actually led the risk management practice for a company called Accenture.
I've heard of them.
And he saw that, they're a small company. He saw that risk management was a major at Georgia, and he got so excited, his eyes lit up. And he was like, you can follow in my footsteps. This is amazing that they have a degree for this now. But the risk management that my father was doing was interest rate risk and hedging utilities and oil and gas prices and all these really sexy financial mechanisms. And when I got to school, I took all my intro classes, right, the first couple of weeks. And I had my intro to finance class and I had my intro to risk management class. And I called my dad after and I said, hey, so this is an insurance degree. My intro to risk management was homeowners insurance 101, and he wanted me to change my major. And I told him, actually, Dad, there were 300 people in my intro to finance class, and there were 30 people in my intro to insurance class. So I think the opportunity is here.
Really
and
smart.
Of course, throughout the 4 years of that degree, I took classes on the employee health and benefits side, and I took classes on the business insurance side. And really the business insurance side just clicked with me. I understood how to protect a building, how to insure a car, but insuring people and walking them through the different co-pays and deductibles and those options was like a foreign language.
Well, it still is.
Yeah.
To almost everybody, including those that have been in the industry for 12 years or so. So I can only imagine at that age, in college, how different it'd be. But I think you made the right choice. If there's 300 and then there's 30, that's a pretty mature decision. But you did have a personal experience about a year ago that it's got to be top of mind around this time of year for you. What'd you learn during that personal experience, that healthcare journey, that healthcare episode? And how has it impacted the relationships personally and professionally today, if you don't mind sharing?
Certainly. So to give a little bit of background, I've had clinical insomnia since 2017.
Nice.
So that means sleepless nights for weeks, even months at a time. So I'll go through seasons where I do not sleep at all. And I had tried everything under the sun over the course of however many years to solve for that. And, prescription drugs, sleep studies, over the counter, you name it, I tried it. And something that was helping me towards the end of 2022 was CBD gummies. My mom had been using them and it was working for her. So she bought me a packet and they were working. So, I'm not going to ask any questions if I'm sleeping.
Right.
And on December 30th, I'll never forget, I ran out of gummies. And so I went to go buy some more. And I bought the same brand that my mom got me. And then I bought a different brand that was advertised as like best sleep of your life. Sure. It was specifically for sleep. And, we go through New Year's Eve. I get back home on January 1st. And like many others, was planning for the new year, wanted to start off on the right foot. Get a workout in, go to bed early. And I took one of those gummies from the new package that I bought at 9 p.m. And by 9:45, I jumped out of bed because I couldn't breathe. And my heart was racing 200, 300 beats per minute.
Wow.
I had a heart condition as a child, and so I know what it's like when your heart's beating that fast.
Yeah.
And I was pacing around my room, freaking out, and I realized that it was the gummy. And so I tried to make myself get sick, but it was too late. And I rushed to the emergency room, and it was only getting worse. I was trying to rip off my clothes because I couldn't get a breath in. It felt like I was leaving my body. And I got to the ER, was immediately put in a wheelchair because I couldn't walk. And I lost my vision, and I had a seizure.
Wow.
And, as I was pleading with God for my life because I thought I was dying, I just realized the fragility of life. And after that experience, my priorities completely changed. People always say that health is the most important thing. It's really the only thing. If you don't have it, what do you have? And that was really internalized for me in that experience. And so to your question about how it changed my relationships, it completely changed the way in which I approach any relationship, both personally and professionally. I spent so much of my career trying to be everything to everyone. I wanted to fit into every box so that I could serve as many people as possible. But that not only was doing a disservice to me, but it was doing a disservice to my clients as well. And so I decided after that experience that I was going to be 100% authentically myself, no matter what room I was in. And I'm not for everyone. So I'm going to share my faith boldly. I'm going to have those discussions that may be uncomfortable because I want people to know what I stand for. Because if they don't know what I stand for, then I don't really stand for anything.
Right.
So I've I've become more myself through the experience, and I've become so unapologetically myself that all of my relationships are a direct reflection of me. And that's just changed the fabric of business and personal relationships for me entirely.
Well, I think, and it's something that we preach here at MarketScale, people trust authenticity more than they trust almost anything else.
Yep.
And it's funny how quickly we can spot a fake, personally and professionally. Sometimes it's harder than others. But for the most part, people are pretty intuitive when it comes to if you're faking it or not. But you fall into this trap, and I can relate, where you're trying to fit in. You're trying to be something that people will appreciate. You're trying to be something that they like. And I use this term seriously because it probably didn't feel like a blessing when it was happening. But what a blessing to have that experience early in life so that you can reap the rewards and pay it forward for the rest of your life.
Absolutely.
And authenticity is, I'm sure it's paid off personally and professionally.
Oh, it has tenfold. I feel more confident in my business, more confident in my personal relationships than I ever have before. And don't get me wrong, it was a very expensive lesson. When I got that ER bill a month later, the sticker shock was real. And thank God for those emergency room doctors and nurses. They really do the Lord's work. But it's quite shocking when you go through that experience. I needed it, so there is not a penny that I regret.
Sure.
But I could afford it, and it made me think about the people that can't.
Yeah.
And it's just our system needs to have a drastic overhaul, that's for sure.
Yeah, the problem with the emergency department, the ED, is it's the most expensive place to receive care for a lot of reasons. But man, in the moment, it feels like when you need it the most, they hit you the hardest financially. And sometimes you can't avoid it.
Yeah.
The education piece to that is, for anybody listening, if you can avoid the emergency room, avoid it.
Yeah.
Use all the other areas or places, locations of care that are available now. Even telehealth has been a huge help for me and my family.
Yeah.
With 4 kids, they get sick often. I've got 2 at home, sick right now. And telehealth has been a big cost saver, convenience maker, and allowed us out in a rural area to get the care that we need. So it's a lesson for everybody. Yeah. But in your moment, in your instance, you got to go.
Oh, yeah.
And we'll pay the check, or we'll pay the bill. Before we move on, did this experience have an impact on your decision to give up alcohol?
They weren't directly correlated, but I would say that I became hypersensitive to everything that I put in my body after that experience.
Sure, I would imagine.
I wouldn't say that I was frivolously putting anything in my body, but I wasn't really thinking about the ingredients or, what was in it. And I learned actually through that experience that these Delta 8 and Delta 9 CBD gummies that are all the rage right now are completely unregulated. So the emergency room doctor shared with my husband that the amount of cases related to CBD in the ER has increased by 3,000% year over year.
That is incredible.
And that was 2022 to 2023.
Scary.
So who knows what that number is now. And so I think I've just been more cognizant of everything that I ingest, whether that be food, whether that be, wellness products. I think that I think a little bit more about it now.
I can see why. And this isn't to knock the CBD industry. There are some great organizations, one here in Dallas called Corganics, that are doing everything that they can to regulate that industry so that the people that it does benefit can gain access to therapy that they need, but safely.
Exactly.
And under regulations that standardize the quality of the product. And so, but that puts us in a role of responsibility where, in this big healthcare ecosystem and risk management ecosystem, people, employers have their own responsibility to understand, to research, make good choices, modify their behavior so that we can be the safest, healthiest versions of ourselves personally, but also professionally and as a business. And that kind of leads me to my next question. How should employers start looking at their business insurance, their risk management, and their health insurance, their employee benefits holistically, going back to what Marsh is providing in this space?
Education is everything. Gone are the days of doing deals on golf courses and on the back of a napkin in a bar. Insurance as an industry has been pretty stale and stagnant as far as adopting new technologies or changing processes and procedures. It's a really archaic industry. And buyers have been conditioned to treat it as such because brokers have kind of resided themselves as mailmen and kind of a delivery service between you, the buyer, and the insurance companies. And so because we're viewed and treated as a middleman, the bar is pretty low from an expectation perspective on the client side. And so I think that education becomes critically important now because businesses face more risk today than they ever have before. And so the level of expertise of your broker partner, by the way, I don't refer to myself as a broker, but I use that term because it's more commonly used. I like to consider myself more of a consultant and advisor. My team and I should be looked at the same level of advisement as an attorney or a CPA to a business. So I think buyers really need to take into consideration the industry expertise of the partner that they have, the solutions and strategies that they deploy on behalf of their clients, and the ability to explain in simple terms such a complex service and product that insurance is. Anyone can go out and acquire an insurance license and sell insurance, but understanding the technicalities of it and what different program structures and solutions will produce for a bottom line, that's a different level that buyers really need to consider.
It reminds me of something that a gentleman I really respect told me a couple weeks ago. And it's this idea that, business operators and owners are so busy working in their business and they're in the weeds of their business and they have a hard time, they have a challenge finding time to work on their business. Taking a step back and understanding, okay, these challenges align with these solutions and these offerings that are out there. Okay, now I need to be educated on all of these different things to help my business. And they have a real, operators and owners have a hard time working on their business, finding time to work on their business. And they lean heavily on consultants and advisors. And so it puts that role of responsibility, that stress on somebody like yourself to build trust and to understand how you can deliver value during that process. And if you can build trust, it builds a lot of authority for you personally, but also for the organization that you work with.
Yep, certainly.
And before I say anything else, thank you for sharing.
Of course.
I think stories like this are important to our listeners, to me personally, to everybody, to know that hard things are going to happen. And we lean on people to help us get through it. But then what we learn afterwards and how we change our behavior and how we take ownership and responsibility of the decisions we make after are just as important. And you've done you're a testimony to that. So appreciate you sharing. Before we let our listeners go, what's one thing that you would want them to walk away understanding?
I tell every single person that I mentor or even really get into deep conversation with this, visibility is your responsibility. And what I mean by that is we all have a unique story, skill sets, things that we've overcome in our life. And it's our responsibility to share that. Even if you don't think you're going to change the world or make some monumental impact or be on a big stage, there is at least one person out there that needs to hear your story because they're going through the same exact thing.
Yeah.
And by you sharing that story and having the visibility allows them to understand and internalize that they can overcome whatever challenge it is that they're facing. And I think through my experience, with a brush of near death, or at least what felt like it, I realized that I am most powerfully positioned to help that person that I once was. So the girl that was insecure and trying to be everything to everyone and trying to fit into every single box that I could, I can help that person. So I've really taken that to heart, and everything that I do, every conversation that I have, every decision I make is to help that person so that I can demonstrate to her that there's light at the end of the tunnel. There's a better way to live your life, and living authentically to who you are allows you to leave a lasting impact and legacy on this world.
I couldn't say it any better. Something that I tell our kids, something that I try to live by is it's not about you, and it's about the people you can help. And, I used the word blessing earlier. When you're blessed with experience, when you're blessed with knowledge, when you're blessed with this opportunity to learn, don't be afraid to share, because it's not about you. It's not about how you look or how you sound. Mm-hmm. There's somebody out there that could benefit from it, could learn from it, could improve from it, and overcome a challenge that they're facing, whether that's a personal challenge or a professional challenge. And you've implemented that on both sides of your life, personally and professionally. And that's exactly why we started Highway to Health, is to celebrate people just like you. So thanks for being here.
Thank you for having me, and thank you for everything that you're doing. You're certainly leaving your legacy and making an impact, and I love seeing you live authentically to who you are.
You're welcome back anytime.
Thank you.
Thank you.